Healthcare scientists, I think, have a bit of a rep of being like the backroom boys, where they spend a lot of time in labs and do a lot of the clinical work behind the scenes.
Healthcare science is really important because people don't realise the breadth, the different specialisms you can go into. You know, it's not just doctors and nurses, there's lots of different specialities, and it's really important that we all talk about the different jobs that we do and people know about the different opportunities there are within the NHS, because as I said, it's not just the doctors and nurses, it's all the people in between.
Of course, I'm a little biased in saying this, but I believe without us, all the investigations that are crucial to achieve not just your diagnosis, but also to follow up on your patients and decide on the better course of action for them, it would not be doable without having healthcare scientists.
As a child, when you think about working in a hospital, and from children that I've met, they say, oh, I think it's really cool to be a doctor or to be a nurse because it's nice because they look after patients and help them get better. So when they ask what I do, they say, well, what is your job in the hospital though? And I say, well, for instance, when people have their symptoms, so something is wrong, but the doctors don't know why, they then have tests that we do to then tell the doctors what is wrong.
Statistics have shown up to 80% of clinical diagnosis is made on the back of a pathology result, be that for haematology, biochemistry, histology, microbiology and any of the other ologies that are there.
The reason why any student would like to get into the healthcare profession, especially within the NHS rather than a private laboratory, would be the mixed skill set that you are exposed to.
I think really healthcare scientists are perfect for people who have an interest in science, but perhaps don't have the confidence maybe to go into medicine, or they miss the opportunity at university, for example. I think quite a lot of healthcare scientists to a degree realise that this sort of thing is kind of for them, and then go into it from there.
The role of the healthcare professional is to complement and augment the frontline healthcare professionals.
So without us doing our tests, they wouldn't have them answers. So I feel like I help them more, because the doctors really just give them the answer that's written down on the paper, whereas we physically do that task and we get to perform the test with all super interesting machinery.